Hello again, it's Dr. Ade. Good afternoon. And today we're going to discuss ectopic pregnancies. It's a very sensitive topic for me because I've never had one. However, the first patient I saw in A&E as a medical student actually had ectopic pregnancy and the outcome wasn't very good. So I'm going to discuss the symptoms with you and I want you to watch out for them, obviously in females. So number one is you would have to be pregnant, obviously. So that means generally you would have had to have had a delayed period. This is easy to say when you have regular periods and it hasn't come for about 1 or 2 weeks. You just know instantly there's a problem. Do a pregnancy test, you know you're pregnant. If, however, you have irregular periods, you have to be quite observant. So it's the nausea, is the breast tenderness and breast swelling, it's the not feeling quite right, eating more. So I want to say in those cases, the first thing I would do is a pregnancy test. Pregnancy tests are quite sensitive nowadays. So we've now concluded that you may well be pregnant, is it in the right place? Ectopic pregnancy means that the pregnancy is not within the womb, it's outside the womb. So it could be in the tubes, it could be in the abdomen or the pelvis, it could be anywhere but not within the womb, and it causes pain. The ones that can cause the smaller the area is where the pregnancy is located, the more pain you can have. So if it's in the tube, within 6, 7, 8 weeks, you know there's a problem because you start having pelvic pain. It's usually one-sided to one tube or the other. There's some areas you could have ectopic pregnancy where the pregnancy can actually grow to a considerable size before you even know that you've got ectopic pregnancy. Now, the problem with ectopic pregnancy is actually the rupture. So if you have rupture and bleed, it can be quite dire. So that means, say it's in the tube, it grows beyond 6, 8, 9 weeks, you start having one-sided abdominal pain. When you're pregnant with usually minimal bleeding on the outside, then the pain can get so bad with the rupture, and then your blood pressure starts going down because you're bleeding internally. So I want you to be quite observant, and anytime you're pregnant and you have one-sided abdominal pain with minimal bleeding, you have to let us know as soon as possible. It is a medical emergency. If you can't get to your GP, you call what we call the early pregnancy assessment unit or go straight to A&E. Early pregnancy assessment unit will do an ultrasound scan, usually the next day. Thank you very much. I hope you find this useful. I'll continue in the next